Let me be very clear. Many doctors fail medical exams not because they lack knowledge, but because they sound unsafe. You can take a perfect history, you can examine beautifully, you can even explain the diagnosis correctly, and still fail, because you cannot explain management, consent, and next steps properly. This is where examiners decide, is this doctor safe to work with patients? Today, I'll show you how to explain management clearly and professionally, how to ask for consent like a safe doctor, and how to close a consultation in examiner-approved English. This is the final consultation skill, and examiners absolutely love it. Part 1. What management really means. Management is not just treatment. In exams, management includes investigations, medication, monitoring, safety netting, and follow-up. When examiners listen to your management plan, they are not testing your medical knowledge. They are testing clarity, structure, patient involvement, and risk awareness. Your goal is shared decision-making, not giving orders. And this is where many good doctors lose marks. Mistake number 1, giving orders instead of explaining. Wrong. You need to take this medication. We will do a CT scan. This sounds authoritarian. To examiners, this sounds like, this doctor does not involve patients. That is unsafe practice. Correct. I'd recommend starting this medication. What I'd like to do next is arrange a CT scan. Examiner-approved phrases. I'd recommend. Orders equals control. Recommendations equals care. Memorize that. Mistake number 2. No structure in management. Many candidates jump randomly between tests, drugs, follow-up, tests again. That sounds anxious and unprofessional. Examiners want structure. Use this simple framework: immediate plan, investigations, treatment, follow-up. Think IITF. Structure shows confidence, calm thinking, and senior communication. Without structure, you panic when interrupted. With structure, you sound safe. Examiner interruption test. Here's a real examiner test. They interrupt you and ask, what would you do next? If your plan has no structure, you freeze. If your plan is structured, you continue calmly. Structure protects you under pressure. Model management structure. Listen to how this sounds. First, I'd like to arrange some blood tests today to check for infection or inflammation. Based on the results, I'd recommend starting appropriate medication. We'll then monitor how you respond to treatment and review your symptoms. If needed, we can arrange follow-up or further investigations. This sounds native, calm, and safe. This is exactly what examiners want. Mistake number 3, not explaining why. Wrong. We'll do a blood test. The patient is confused. Examiners notice that. Correct. We'll do a blood test to check for infection or inflammation. Explanation builds trust. No explanation equals poor communication. Mistake number 4, poor consent language. Wrong. Sign here. We have to do this. Massive exam red flag. Consent is not a form. Consent is a conversation. Examiner-approved consent phrases. Is that okay with you? Do you have any concerns before we proceed? You're free to ask questions at any time. Examiners are listening for permission, not pressure. Mistake number 5, ignoring risks and side effects. Wrong. This medication is safe. Too absolute, unrealistic, unsafe. Correct. Most people tolerate this medication well. Some people may experience mild side effects, which I'll explain to you. Balanced risk language is examiner gold. Never promise perfection. Mistake number 6, no safety netting. Wrong. Come back if it gets worse. Too vague, too careless. Correct safety netting has 3 parts: what to watch for, when to seek help, and how urgently. Example, if you develop fever, chest pain, or worsening symptoms, please seek medical help immediately, either through emergency services or your GP. This shows responsibility. Mistake number 7. Bad consultation closing. Wrong. Okay, bye. This sounds careless. Professional closing. Do you have any questions? Let me summarize the plan. Thank you for coming in today. Strong closing equals professionalism. Perfect management and closing model. If you say the next part well, you pass this section of the exam. So, to summarize, first, we'll arrange some blood tests today. Based on the results, I'd recommend starting medication. Most people tolerate it well, and I'll explain the possible side effects. If your symptoms worsen or you develop concerning signs, please seek medical help immediately. Does that plan sound okay to you? Do you have any questions before we finish? That is exam ready, workplace ready, and safe doctor English. Final series closing. If you've watched this entire series, you now have admission language, history taking, examination English, diagnosis explanation, and management and consent. Subscribe if you're serious about working abroad as a doctor. Comment below, which exam are you preparing for? And remember, good English doesn't impress examiners. Safe English passes exams. Follow for more Medical English Pro.